Hi everyone, today's topic is birth asphyxia and hypoxic ischemic encephalopathy. Hope you people are enjoying the audiobook sessions. So without further ado, let's get started. Perinatal asphyxia means there is impaired gas exchange in the fetus during pregnancy or due to complications of labor, and that leads to hypoxia, hypercarbia, and lactic acidosis. Lactic acidosis is established by taking the blood sample from umbilical artery and the pH should be less than 7. According to WHO, birth asphyxia definition is when baby fails to initiate breathing or not able to sustain the breathing at the time of birth. So failure to initiate or unable to sustain. What are the consequences of birth asphyxia? See, because of the asphyxia, there is hypoxia, and this hypoxia eventually causes organ damage. So, there is hypoxic ischemic encephalopathy in brain. There may be multi organ failure like acute tubular necrosis in the proximal tubule, and there may be anaerobic metabolisms that will be started in the tissues leading to lactic acidosis. So this eventually decreases and there will be a persistent low Apgar score in the babies of birth asphyxia. Remember, hypoxic ischemic encephalopathy is the leading cause of neonatal brain injury worldwide, and also it is the leading cause of neonatal seizure. If you remember, the most common cause of childhood seizure is your febrile seizure, but neonatal seizure ka most common cause is hypoxic ischemic encephalopathy. Now, the neonatal encephalopathy is staged according to Chernut and Chernut staging. According to this, there are three stages: stage 1, 2, and 3. Now, you need not remember all the stages and the clinical features of each of the stages. Few points that you need to remember, like in stage 1, the baby's consciousness is normal or hyper alert, and the reflexes are also elicitable, easily elicitable. There is no seizure and everything is kind of normal, and the outcome is also good. Stage 2, the baby is lethargic and there is sluggish reflexes like Moro's reflex, shucking reflex, these are sluggish, and very important is seizure. So there will be seizure in the first 24 hours because in stage 1 there is no seizure, and stage 3 may the baby is comatose, so there is no activity of the brain, so no seizure. So if there is seizure in HIE, that is stage 2. Okay, stage 2 ka prognosis is good because 80% have a good prognosis, good outcome. 20% may land up into various sequelae like cerebral palsy and intractable seizures. Stage 3, the babies are comatose and there is absent reflex, no seizure activity, there is a decerebrate posturing. Decerebrate means abnormal extension, that is M2 in the GCS staging. Okay, and 50% of this stage 3 will die and 50% will land up in cerebral palsy or other sequelae. So this Chernut and Chernut staging is done for neonatal encephalopathy. Let's discuss the patterns of brain injury due to birth asphyxia. So need to remember two things only. One is parasagittal infarct. Number 2 is periventricular leukomalacia. These two terms only. First is parasagittal infarct, that is seen in term babies due to birth asphyxia. So basically the watershed area supplied between the anterior and middle cerebral artery, that area is affected. So the upper limbs are predominantly affected, then one by one all the four limbs eventually get affected, and ultimately these babies are presented with spastic quadriplegia cerebral palsy, where in case of preterm babies you get periventricular leukomalacia, where it affects the motor distribution of both the lower limbs, and there is spastic diplegia cerebral palsy. So two terms: parasagittal infarct in term babies, quadriplegia, and periventricular leukomalacia preterm babies, diplegia. Both are spastic. Now, to screen HIE, we need neurosonogram, that is ultrasound through the frontanelles. Only small part of the brain is visualized, that's okay, but the main role is to rule out any significant intracranial hemorrhage is present or not. That is the screening process, that is neurosonogram. But the definitive investigation of choice in HIE is MRI brain. Though in early cases you can go for diffusion weighted imaging studies that will obviously show you some early changes within few hours after birth. Generally, there is no treatment. You cannot completely cure or reverse the situation. So, only supportive management like maintenance of the blood sugar, maintenance of the temperature, and maintenance of the hydration status, these are important. Also, bedside monitoring of the seizure activity can be done by amplitude integrated EEG. That is what we can do, but the diagnostic test for detection is your conventional EEG only, because that will diagnose the thing. Screening test के लिए we can use amplitude integrated EEG, and that is having many advantages over conventional one. Number one, it is bedside. Number two, it has only 1 to 2 electrodes. Okay, conventional EEG has 16 electrodes. And number three, conventional EEG needs expert evaluation, but here you need not. So it just detects the subclinical seizure activity in ICU patients. So screening test के लिए we can use that. So diagnostic test is conventional EEG for the neonatal seizure here. What will be the treatment of seizure? Obviously the drug of choice is phenobarbital. As we know, in case of adult we use benzodiazepines first, but here is phenobarbital the drug of choice. If not responding, then we can add on phenytoin or levetiracetam, and finally we can give lorazepam or benzodiazepines like injection midazolam can also be given. Okay. Next, you can also apply therapeutic hypothermia. Therapeutic hypothermia means you are creating a cool environment in the body by placing ice packs or cooling crystals around the baby's body. So generally whole body cooling done. Only around head like selective head cooling can also be done, but preferred one is whole body cooling. Here the temperature that is maintained is around 33.5 degrees centigrade. Between 33 to 34 degrees centigrade we generally prefer. The mechanism is basically it decreases the neuronal apoptosis. So by preventing or decreasing neuronal apoptosis, and also by decreasing the production of the excitatory amino acid that is glutamate, it decreases the seizure activity also. Okay. Thus, this is very important. This is a new concept in the management of HIE. The criteria for therapeutic hypothermia are: first of all, the age should be more than 36 weeks of gestation. Birth weight should be more than equals to 2 kg. And therapeutic hypothermia can be adopted in stage 2 and stage 3 only. That should be started within 6 hours of birth, and duration maximum is 72 hours. Repeating, age more than 36 weeks of gestation, birth weight more than equals to 2 kg, stage 2, stage 3 HIE, started within 6 hours, maximum for 72 hours.